right, we're going to go ahead and get started. Thank you to everybody who came and who's here today. We are here to talk about our team, Health Equity and Advancing Literacy, otherwise known as HEAL DC. My name is Jackie Ramelt. I work at American University as a program manager with the Healthy Schools, Healthy Communities department.
Yep. I'm Robin Clegg. I also work at American University in our Healthy Schools, Healthy Communities lab. And we'll just be giving you an overview. And
jump right in.
Yeah.
Yeah.
We can save questions for the end, or if you feel like it's really relevant to the slides we're on, feel free to jump on it.
Yes. So part of what we do is assisting DC Health in enhancing health literacy efforts by hosting pop-up events with our faith-based and community-based partners in wards 4, 5, 7, and 8. So we're going to talk about everything that goes into these pop-ups and all the planning and implementation, sustainability, and evaluation that goes into it. So there we go, all the planning and implementation. All of these steps are essential to making sure that we have successful pop-ups, and our goal is to make sure the residents of the DC wards have all the tools necessary to take the best control of their health possible and are given the tools and confidence to live healthier lives. So the first part of the planning process is the Find No Use framework that they discussed previously this morning. The AU team supports the 3 broad goals that research demonstrates must be achieved to improve health literacy, that individuals find, understand, and use the information given to them to create better health-related decisions for themselves and the people around them. And through this planning process, we created flyers and interactive activities along with the health information that aligns with the health observances of the month. And we are better able to give participants the tools and better equipment to find, understand, and use health information to create and maintain healthy habits. So the first part of our pop-up, right after the sign-in, where they answer a number of anonymous demographic questions with us, they move to the find part of the station, which focuses on how to find health information. And we give the participants a handout similar to the one that is up on the screen. And the handout provides resources that help support and teach more about the health condition that we are focusing on that month. The flyer contains low-cost or free online and in-person resources for the participants to go to. A couple of examples are shown up here. And these flyers are created by our HEAL team, and they are researched online through reputable sources. We look at different centers, clinics, community organizations that could be the most suitable for our residents and are convenient to them. And if they are in-person organizations, they are most likely in wards 4, 5, 7, and 8. We also have a Spanish version of the flyer for our small Spanish population. And at the end of this part of the station, they will also receive a corresponding incentive or material item to go along with the flyer, something like a water bottle or hand sanitizer, reusable bag that they can take with them throughout the rest of the station and outside of the pop-up. So then they will move on to our know part of the station, which focuses on the information that the participants should know about the health topic at hand. Here's another example. We are focusing on mental health in the month of May, so that's kind of going to be a little bit of the theme of this presentation. But our know flyers can also focus on prevention topics such as skin health, healthy sleep, or exercise. And they'll basically just provide basic information such as a definition, symptoms, prevention strategies, or care management about that health topic. We're really giving them the basics of the health information, and with the Find flyers, they are able to learn more about that health topic through the centers that we provided. So these no flyers are also provided in Spanish as well and are created also by our HEAL team. Researched online through reputable sources such as the NIH or CDC, and also have corresponding incentives with them. So in this particular case, we might provide a scented candle or a cookbook, something to relieve stress, help your mental health a little bit, help you out with some self-care. Before moving on to our final part of the station, which is the use. It is our interactive portion of the station. It focuses on applying the information that was given to them in the find and know parts of the pop-up. And the interactive activity that we do with them, as seen in the picture, it could be a Jenga game, a spin wheel, a Plinko, and there are corresponding trivia questions, usually true or false, that go along with these games. And the whole idea is to just open up a conversation about that health topic with the residents. So we will quiz them a little bit on the health topic, and whether or not they get it right or wrong, they will also receive another incentive as well. They might get, in this case, a wellness journal where they can track their sleep, use it as a nutrition log, a stress log, and take those incentives and move on. So like I previously mentioned, we try and align our pop-ups with the health observances. We do them with the national health observances of the month. So as you can see here, some of them already align. We have February heart health, we have October breast cancer. Some of these are already known. But we also try and consider the demographics that we're trying to reach as well and tailor them a bit to who we're talking to. Each month, as you can see, covers a new topic. So this keeps our participants engaged and constantly learning. And for our repeated participants who come back to multiple events or are associated with one particular partnership, they will have different items, different flyers, and different information from the last time they came. So this moves us on to the implementation part of our whole program. And this involves maintaining our partnerships with our faith-based and community-based partners, recruiting our HEAL team members, and finding those incentive items that people love to take with them at the end of our pop-ups. So I'll first talk about our faith-based partners who attract hundreds of participants. We meet with them twice a month, every month. They are our most consistent partners. They bring the most participation, and they've really been wonderful to work with, and we hope to work with them very long into the future. The first one that I'll touch on is Urban Outreach Ministries. This is a faith-based organization that provides a technology center for their youth members, food drives for their families, and a children's ministry. It is run by their executive director, Pastor Will, who was our main point of contact. And we collaborate with them on their weekly food drives. Even though we go to them once a month, we try and make sure we go on the same day as their food drives. And we also partner with them on their annual turkey giveaway for Thanksgiving, which attracts, I want to say, close to 500 people. So it's really a great opportunity to reach as many people as possible. And with this particular organization, we try and work with them months or weeks in advance to make sure we have enough supplies, enough staffing, and really try to prioritize that partnership. Next, we have Pilgrim Rest Baptist Church, another faith-based organization. They provide monthly vaccination clinics for their members, and those are the events that we try and collaborate with them on. They attract many people, and it becomes more of a health fair situation with our health literacy information and their vaccinations. They provide vaccinations for COVID, TB, flu, anything under the sun. And we work with their outreach coordinator, Mary Douglas Brown, who's known by her friends as Miss Mary. And she's been a major support. She's also really opened the doors for us to other community partnerships and help us kind of reach different ground in wards outside of 7, which are Pilgrim Rest and Urban Outreach are both in Ward 7. And then lastly, we have the Wesley Theological Seminary. We worked with them through the Faithfully Fit program, which began by certifying health ministers at each of the faith-based organizations through WTS, through their Heal the Sick program, which trains members on whole person health and health ministry models. The program provides technological assistance to health ministers to implement evidence-based health programs, and they've certified 19 health ministers in 6 local faith-based organizations. People included are Pastor Will with Urban Outreach and Miss Mary through Pilgrim Rest, which is how we were able to start those partnerships. And now on to our community-based partners, who are just as important as the faith-based partners. A lot of our community-based partners, we meet through our faith-based partners. They are a huge part in making our pop-ups successful. Their participation numbers range from just a handful to hundreds. So it really helps us reach as many people as possible. We reach out to them months in advance to explain what we do, explain how we can collaborate with them, what is the best way we can work with them to make sure that these pop-up events are cohesive. And we usually collaborate with them on their existing health fairs or community engagement events. We coordinate also to make sure we can schedule the pop-ups for once a month. For the community-based partners, we do our best to have an event once a month with them, and then Pilgrim Rest and Urban Outreach, we meet with them for the other 2 events of the month. We make sure to talk through supplies, staffing, and any other sort of assistance we can provide. Then I'll move on to our HEAL team, who have done a lot to help us out in this whole program. Our HEAL team consists of 5 to 6 AU students, both graduate and undergraduate. They are usually pursuing a career in public health, health promotion, or some other health-related fields. And they are also just very passionate about improving health literacy levels. They do so much to help us by researching and creating the content for their Find and Know flyers. They research our trivia questions for the use activity. They lead the stations at the pop-ups. They pack up the supplies, help to bring the supplies. When we originally had our sign-in information as paper instead of virtual, they entered that information into our data system. And on top of that, they're just very bright and engaging students who have had really meaningful conversations with our residents, and we know they're going to go on to do great things. A lot of them were seniors this year, so we had to say goodbye to a lot of them, but they're going to do wonderful things. And then finally, we have the incentive items, which I mentioned earlier. We always make sure that we order enough for our faith-based partners and our community-based partners, so 3 events per month. We want to make sure it's a useful item that they can use outside of the pop-up and use to maintain or create healthy habits, and something that's enjoyable for them to use. I would say it's probably one of the most meaningful parts of the program is to give away these items. You think you're just giving away a little trinket or something, but we have a lot of people who come back saying, did you have that cookbook from last month, or can we have another vital sign log book or something like that? And they really enjoy using them. They always ask for more for their family and friends. And it's really great to see people take advantage of the great opportunities that we're able to provide to them and use these items in their daily lives and be excited about taking control of their health. Now I'll pass it off to Robin.
Thanks, Jackie. All right, so the first part they're covering planning and implementation is kind of everything that has happened. And I'm going to be covering sustainability, kind of where we want to go from here, and then also the evaluation that we've conducted to see the impact of the work of HEAL. So as Jackie mentioned, partnerships were a huge piece of doing HEAL. We weren't going out and doing pop-up events on our own, like at a health fair style. We were trying to build off of pre-existing events that were already taking place and add health literacy as a component of that. So Urban Outreach and Pilgrim Rest Baptist Church were actually partners of ours in the past in a previous grant that we were working on called Faithfully Fit. Wesley Theological Seminary as well. So I think when we're talking about sustainability, we're looking at how these relationships and partnerships continue to build and evolve from project and program and into the future. So knowing that we've worked on them and Faithfully Fit and saw the capacity of their churches and health ministries, we saw an opportunity for that to be an environment where health literacy could be received well and continue to further the health goals of their particular organization. And I will say Urban Outreach and Pilgrim Rest, we're already partnering with them again on our next project that's not necessarily related to health literacy, but health literacy really kind of underlines almost all of the work that we do. Wesley Theological Seminary I'll specifically speak to because they were built into the sustainability aspects of this grant, where they have a program called the Heal the Sick Certificate. Again, that was caught a connection from our previous work in Faithfully Fit, but this is how someone becomes a certified health minister. Then they may, in their respective church or congregation, lead a health ministry that pursues different health projects for their congregation. So in working with Wesley Theological Seminary, they built health literacy into one of the modules of this certificate program, and it hadn't previously been there. So this 10-module program that covers kind of everything that a health minister needs to know now also covers health literacy, which is a really important feature to build into all of the people who take this certificate every year. People sign up for this certificate from across the globe, a lot here in DC, but across the nation, and then also internationally. So we think that that's a pretty cool opportunity for health literacy to continue to have legs much beyond the time of this grant. What's also unique too, and kind of came out of this, was that previously you took the whole 10-week course, and now you can sign up for just specific modules of the Heal the Sick certificate, and health literacy is one of those modules. So it was really great to work with Tom Pruski, our contact there, for this. Another aspect of sustainability that came out of this work was, as Jackie mentioned, materials were created every single month that we did pop-ups, which amounted to 11 months out of the year. So we were guided a lot of the times by national health observances, but also by what was outlined in this grant for areas of disparity that we should be focusing on. So this HEAL resource packet now, so that I don't get anything wrong here, we have 6 preventable health conditions, 3 chronic diseases, 2 communicable diseases, and a list of all the centers, clinics, and in-person resources that are available here in the DC area, with specific focus on, of course, wards 4, 5, 7, and 8. So we've taken all of the materials that were created for the find, know, use concept and bundled them into this full resource packet. And that can outlive the time of this grant for many months to come, because as you know, health observances don't change that much from month to month. If something's a February observance, it's going to stay a February observance. All right, so now moving on to evaluation. As was discussed this morning, certain organizations got their funding at different points in time. Our work started in December 2022, and of course, we are here now in May of 2024, but our events ended in April of 2024. So across the, give or take, can't do the math, 16 months, we have had 41 pop-ups. Our goal was to do 3 to 4 pop-ups each month, always with our 2 consistent faith-based partners, and then adding in a 3rd or 4th event with a community-based partner as well. Across those 41 pop-ups, we had 10 partners, and we reached 1,371 participants across wards 4, 5, 7, and 8. So I'm going to dig into that a little bit more deeply in the next few slides. So here's a summary of the events held, the participants reached, and where they were located. So as you can see, because Urban Outreach and Pilgrim Rest were our consistent partners every single month, they have the highest number of participants reached and also the most number of events. We started having events in February of 2023 and finished events in April of 2024. 19th Street Baptist was the second most, second most common location that we had events, and then other locations having 2, 3, and sometimes a single event. And I'll get into kind of, I think we have the averages on how many were most people at. All right, so this is a bit of a busy slide, and this is an important piece of how we evaluated the impact of our pop-ups, because we weren't interacting with individuals that long. But we needed to know that we weren't going to come back from a pop-up and just say we talked to 12 people. What honestly do we know about those individuals that we talked to? So over the course of the 16 months that we were out doing pop-ups, this survey did go through a few iterations. We will say that some of the questions we asked in the beginning we got rid of and they've been replaced by other things. But in a nutshell, we had first asking people their provider-patient relationship questions. So these, if you take a moment to skim through them, we're really asking how doctors and health professionals explained things in a way that was easy to understand, if they listened carefully to you, and if they showed respect for what you had to say. It's an important part of health literacy is those patient-provider interactions and making sure that you can ask questions, feel like they understand your questions, and also that you're being attended to for the reason that you came in for that appointment that day. We also asked, where do you go first to find health information? We just think that that's an important indicator of how people find trusted information. And results to come on that, but it was pretty much split between the internet and your doctor. Sometimes people asking family members, but more so Googling things and then also talking to a doctor, which is a good place to be. The third section was food insecurity screening. So I'm sure many of you are familiar with the 2-item screener, asking people if they worried whether food would run out before they had money to get more, or whether the food they bought didn't last and didn't have money to buy more. And then to also sort of check how many people we were reaching on a recurring basis, we asked, have you been to one of our Health Strong events in the past? Previous renditions of this did ask COVID-19 questions, so if you're familiar with this project, you know that in the beginning we did have a heavy COVID-19 focus, and that sort of dissipated as COVID-19 dissipated. And we did add in the question about where do you go to find health information. And we did have 3 chronic disease questions, but felt that those were no longer sort of representative of health literacy, and asking people like, how does managing a condition go for you? Does your health usually turn out the way you would like it to? That's not necessarily going to equate with health literacy. A lot of times we do what we can for our health and it maybe still goes in a different direction. So this was revised in conjunction with guidance from DC Health and kind of the questions and instruments that they wanted included and assessed.